Medicine, Grand Rounds. We have a wonderful session planned for today, which is really part two. Our first session was such a success that this is the second session. And the title of today's Grand Rounds is UCSF Community Partnership for Local Chronic Illness, for Local Chronic Disease Equity. Lessons learned, challenges, and opportunities of San Francisco's soda tax years. Our speakers today are Anisha Patel, Marianne Zetto, Jonathan Butler, Joy Jackson Morgan, Abby Cabrero, and Roberto Vargas. Um, and just as a reminder, before we start our session, today's session is recorded. If you, as I mentioned, this is part two. So if you want to see part one or go back and see this session again or any other sessions that we've had on Family Medicine Grand Rounds, you can always find us on the UCSF Family Medicine Department website under Grand Rounds. And also, while you're there and thinking about Grand Rounds, if you really like Grand Rounds and you can't imagine anything better than having a full day of educational presentations, we've got a colloquium for you. We are planning the annual UCSF Family Medicine Rodnick Colloquium. The date for that is May 22nd. And for folks who are interested in submitting an abstract for a poster presentation, a workshop, or an oral presentation, those are due this January. The applications are on the website for submissions, and we hope to see lots of submissions for a wonderful colloquium. Today's presentation is really so well aligned with the goals of our department and the mission of what we do in family medicine. Today, we will hear about how UCSF community and city partners have advanced water equity and leveraged the San Francisco soda tax revenue to make measurable improvements to community health. We'll also hear today from our great group of presenters about promising opportunities to re-engage with community leaders and to save the imperiled resource that is the San Francisco soda tax. This is an absolute testimony to the strength of collaboration and community building, and I could not be more excited to welcome our presenters today. Thank you. Oh, and always forgot to mention, if you have questions for our presenters or comments, please use the Q&A button on your screen. We really want this to be an engaged and exciting presentation with lots of opportunity for dialogue. And also there will be an evaluation if you have suggestions for our presenters today or ideas for future grand rounds. So thank you. And with no further ado, I want to welcome our presenters.
Thank you so much, Dr. Venner. My name is Roberto Ariel Vargas. I'm the Associate Director of the Center for Community Engagement and Senior Staff with the Clinical and Translational Science Institute, working there with the Community Engagement Program, the Research Action Group for Equity and Impact. And today we're going to hear from a number of collaborators that worked from UCSF and with UCSF in order to advance chronic disease equity. Hopefully, you've had an opportunity to listen to part one, where we talked about work leading up to the soda tax that passed in 2016 in San Francisco. And this really began with us at UCSF looking for ways to leverage our expertise, our science, our evidence to help shape policy, to help shape public health approaches, and also to find ways to more deeply partner with local community, including community-based organizations and the San Francisco Department of Public Health. So you'll hear from presenters today who are both community leaders as well as civil servants with the Department of Public Health and faculty, beginning with Dr. Patel from Stanford, who was also faculty with UCSF. I'm going to do a quick recap of part one just to ground us, okay? If you were not here with us in part one, we discussed what led us to a soda tax. So it was work in education, research, and then advocacy around policy and structural change. This is a timeline we reviewed and discussed in detail. Please take a look at the Family and Community Medicine website for that archived recording. We talked about the prevention spectrum, all the way from addressing the needs of individuals up to policy and legislation. And legislation included structural change like investment in the public water access infrastructure. We'll discuss more later. And this was a coming together of multiple coalitions, including Shape Up San Francisco and the San Francisco Health Improvement Partnership. And we worked together by way of the collective impact model, multi-stakeholder efforts, primarily focused in communities burdened by disparity in chronic disease, and with folks in community leading to improve access to healthy foods, um, and folks leading education in community around sugary drinks and their impacts in multiple communities. And at the university, leveraging our research and evaluation. And one of our research partnerships with community led us to understanding that folks uh, supported some policies, including a policy on taxing distributors of sugary drinks, and that folks wanted better access to clean drinking water they could trust. Um, we talked about the lead up to the first tax proposal of 2014, and then other policies, including a ban on purchases of sugary drinks, adoption of healthy drinks policies across all hospitals, and then ultimately the passage of the soda tax in 2016. Today, you'll hear more about what's happened since the passage of that tax in 2016, including implementation of the tax, making recommendations for how to invest that money, and then work around water equity. So I'll stop there and hand it over to Dr. Anisha Patel to share more about how she helped us advance work in water equity.
Great, thanks so much. I'm just going to take a moment to share my slides. Perfect. Can everybody see that well? I'm going to go ahead and get started. So thanks so much, Roberto, for that wonderful introduction. So as mentioned, my name is Anisha Patel. I'm a professor of pediatrics at Stanford, where I also direct the Office of Community Engaged Research in the Maternal and Child Health Research Institute. And as Roberto noted, I had the opportunity to work at UCSF as a faculty member for almost 8 years prior to my position here at UCSF. And I'm excited to tell you more about our partnerships to advance drinking water equity in San Francisco communities. So many of you probably already aware of community-based participatory research, but for those who aren't, this is a partnership approach to research that equitably involves key partners and researchers in all aspects of the research process. So as you can see here in this figure, that includes, starting from the beginning to understand what are the priority issues and research questions that community want us to address. Working with partners to co-design and conduct the research. And then once you have the results in hand, also thinking about how we best interpret the research findings and disseminate and translate those findings so that they can ultimately have impact on policies and practices in the real world. So I wanted to take an opportunity to apply that community-based participatory research approach to this effort to advance water equity as a part of this partnership. And this work that I'm showing on this slide actually precedes my time working on this project, but Kevin Grumbach, Roberto Vargas, Laura Schmidt, and many others here on the call had done some work preceding the water equity efforts, really to identify what our community needs. And sugar sweetened beverage intake emerged as a need, as identified here by these 4 criteria. So one was that there needed to be evidence of population level health inequities, which there were for sugar sweetened beverages, with African American and Latino children and teens consuming sugary drinks at a much higher rate than whites. It also had to be an issue that was amenable to evidence-based prevention, which in this case was sugar-sweetened beverage taxes. There needed to be some UCSF expertise in the area, and for this, UCSF health scientists were actually pioneering research demonstrating the impacts of added sugars on health. And lastly, what were opportunities to leverage ongoing efforts? And the Shape Up SF Coalition was already working to address sugary drinks, so this aligned really well with city priorities. So the next step then, after identifying sugar-sweetened beverage taxes as a prevention strategy, was to conduct focus groups with residents to understand what they thought about those types of policies. And one theme that emerged was that the tax funding should be used to benefit local communities. So how could we ensure, that the tax funds were used in a way that they could have local impact? A second theme was, if we're going to, implement a taxation to discourage sugar-sweetened beverage consumption, how do we couple that with policies to promote access to free, clean, and safe tap water for those local communities as well? So this is when I came into the picture. At UCSF, I was conducting research on water equity, primarily focused on school settings. And so Roberto Vargas and Laura Schmidt knew that, and they said, do you want to join this effort given your expertise? And I was really excited to be involved. And on the left here, you can see all of the great organizations that were involved in these efforts, ranging from community-based organizations that you heard from on part one of the presentation, to Parks and Recs, the San Francisco Public Utilities Commission, as well as the Department of Public Health. And what happened was there was a lot of public education and also education of key decision makers to encourage investment in reusable water bottle filling stations in parks in low-income neighborhoods to really respond to the feedback that we heard in the focus groups, right? That community wanted to make sure there was access to safe drinking water if there were going to be taxes that were implemented. And so you could see the timeline here. The tap stations got installed in winter in 2017, and then the SSB taxes, which were passed, got implemented in both Oakland and San Francisco. And at the same time, there was also culturally relevant promotion of tap water intake instead of sugary drinks for the community-based organizations. And so we were able to secure some funding to collect some data before and after these efforts. You can see that we conducted observations in parks of what visitors were drinking, and also conducted audits of the condition of drinking water sources in these parks. And as this was a community-based participatory research design, we came in when things were already kind of happening. So it wasn't like I could, as a researcher, design a perfect randomized control trial. Instead, this was a quasi-experimental study. And so we decided to take 10 parks that were going to get these new water stations, water promotion, and were in areas where taxation was going to occur, and then select 10 parks in other areas where there weren't going to be the installation of the water stations or the water promotion, which you can see here. And we tried to match as much as we could to be similar. And so I just want to highlight this picture. You could see an example of a water source in a park before the intervention occurred. And then you can see what the drink tap stations look like. So there was a lot of community input that went into kind of picking those types of stations as well. So now I'd like to move on to the results, which are very high-level results. In this slide, you can see that this is the percentage of visitors who are drinking water from the water sources in the parks. That was our primary outcome for this study. And what you see here in the blue is that the percentage of park visitors who are drinking water from these water sources in the parks did go up over time, compared to the group that's in black, which is the comparison parks. And this was statistically significant after adjusting for a number of factors that we thought were important in statistical analysis. And all of this is published. So if you have further questions about the results, you can go to that publication. We also wanted to look at other beverages that individuals were drinking in parks. So we looked at consumption of water from reusable water bottles in parks, as well as overall water intake, and found that that also went up. We didn't find any changes, however, for bottled water consumption, consumption of sodas or other sugary drinks or juices. So I would like to also highlight, as a part of this community-based participatory research approach, it's important to work with community partners on dissemination and translation of research findings. So a few examples of those are, we worked with Youth Speaks to actually develop educational videos regarding the importance of drinking tap water instead of sugary drinks and other bottled beverages. Some of the prime students at UCSF actually helped to develop this infographic highlighting some of the findings from what we found from the PARC study. We also tried to incorporate results into how-to toolkits for practitioners who are interested in improving water access in their own local communities. And when possible, whenever the opportunity presents itself, we also try to encourage that these findings are integrated into policy guidance, as well as having opportunities to present and educate to key decision makers. So I'd like to leave you to end with a few opportunities if you're interested in getting involved in efforts like this. So one is the Dietary Guidelines for Americans. Their report was released recently, and now is a time when there's open comment periods. So as physician scientists and community members, we can go on and submit public comments and educate the government about some of the priorities for our community, as well as the evidence that exists. And so that is open until February 10th. Governor Newsom also recently issued an executive order to decrease ultra-processed foods, and sugary drinks is a prime example of that. So if you want to follow those efforts, there may be opportunities there as well. The UC's Research Consortium on Beverages and Health, they have a great opportunity for folks to get involved if they're interested in beverages and health, to translate science to policy, and it's all the UC campuses across the entire state. And lastly, we are seeing local soda taxes being introduced again, the most recent being in Santa Cruz. So there may be opportunities not only to educate public key decision makers on the benefits of taxation, but also the importance of incorporating water equity as a part of that process. There are also some drinking water equity resources available. So first, I'd like to highlight the NOPRIN Water Working Group. So NOPRIN is a center that's run by Hillary Seligman at UCSF. And every month we have a meeting that involves community partners, as well as federal agencies and researchers across the country. So if anyone's interested in getting involved in that, that's an opportunity for you. As well as there's also a National Drinking Water Alliance, which is a group of collaborators across the country who are working together to advance water equity, also has a ton of resources available. So with that, I would like to end and just really acknowledge all of the individuals and groups that have played a role in all of these efforts, as well as funding agencies, and shout out particularly to many trainees, including some of those publications that you noted they were involved in actually ensuring that that work got published. So thanks, everyone. I'm going to stop now.
Thanks so much, Dr. Patel. And if anyone's wondering, Dr. Patel was UCSF faculty when she began this partnership work with us. Next, we're going to hear from Dr. Jonathan Butler. Please introduce yourself, and thank you for stepping away from leading the Homelessness Commission meeting of San Francisco to take time with us this afternoon, Dr. Butler.
Thank you, Roberto, and hello to my FCM family. Today, I want to just talk briefly about sort of my role in the SDD Tech, and also just some work that I'm doing with the Black Health Initiative at UCSF. And I just wanted to provide a little bit of context about myself and the reason why I'm so involved in the public sphere. And so just so you'll know, I'm a medical sociologist, a social epidemiologist, and also have a background in religion. So I have a master's in divinity. So I work a lot with our churches in the city. And as a researcher, my focus has been on diabetes and type 2 diabetes and obesity, cardiovascular disease risk, and also a couple of interventions that I've been working on. Now, this has led me to my work with the soda tax and also the Homelessness Commission, among other things that I do in the public. I just wanted to highlight, sort of my role in the soda tax and why I think it's so important for us to, as we're doing research, to sort of move to research to implementation, but also to inform how policy is sort of impacting our community. So as a individual on the soda tax committee, I served as a representative from a medical institution. The person had to be centered around, their experience had to be centered around diagnosis, treatment, and research of chronic diseases And on the committee, I served also as the data and evidence chair, which I had the responsibility of gathering all of the data and evidence, which much of which, I've gathered in partnership with Roberto from UCSF and Stanford faculty that help to support and inform our decision making around how we recommend certain dollars to the mayor. So utilizing, as we all know, data in terms of when we do our research is not just about informing policy, but it plays a critical role in the implementation of policy. And that's where I'm sort of focusing my career path on, is how do we get dollars to the communities which we promised. And so a lot of the work that I've been doing around the soda tax was not only advocating for the legislation, but providing the means to ensure that the dollars actually reach the community in which we serve. So beyond sort of this research and my analytical role, I also served at the time as the health committee chair for the NAACP local branch, in which I was the spokesperson for the Black community in regards to the soda tax. So I did a lot of radio ads, a lot of education, et cetera. And one of the things that I wanted to ensure, again, is that the dollars that were going to be gathered from the soda tax would go directly to the community. And that's one of the reasons why I was so invested in my participation in the committee. So combining sort of the medical expertise, my research expertise with community leadership and the NAACP was the way in which I could bridge the gap between policy and community engagement. And it's also through education and advocacy that we were able to make a difference. And so that is also one of the reasons why I decided to become the commissioner for the homelessness committee, service chair. And so one of the responsibilities for us is approving budgets, formulating long-term goals for the department, establishing department standards. But one of the most important things for me was allowing opportunities for people with lived experiences to have a place to share some of the needs that they weren't necessarily being heard. And so, I think in these roles, it has allowed me to not only, again, do the research, conduct the research, but also ensure that, once we understand sort of the policy recommendations, how to actually implement those policies and making sure the dollars go to where the communities that are most affected. So what I also want to talk about today is sort of my role as the Associate Director for the Black Health Initiative. Myself and Malcolm John, who directs the BHI, is what it's known as, our focus is really to center Black community voices by providing ongoing outreach, addressing resource gaps, promoting health equity. One of the things that we notice in terms of how we disseminate resources into community is that it was only going towards certain communities that focus on Black communities. And so we wanted to look at some of the areas in which that those resources weren't going towards. And so, some of the objectives for us is ongoing outreach and education. We have done a lot of education around the COVID vaccine, et cetera, cardiovascular disease education. We have been a better partner with our community organizations by making sure that we hear what their needs are and actually effectively meeting their needs. One example is that as we partner with Booker T. Washington, and one of their needs were to help with evaluation metrics. And so we partner with Mark Pletcher to create some evaluation metrics for the community, which has been a major game changer for the way in which they do their work. We also wanted to amplify, partner with community members and organizations already doing great work. And so that's one of the reasons why we've chosen Booker T. Washington, but there are other organizations that we have also been in contact with. We also wanted to help build a Black health pipeline. And so part of that is engaging with our not only community, but making sure that we connect our community with our physicians and staff, and also our medical students. So here's just sort of a overview of the things that we've been doing with the Black Health Initiative. We've been co-sponsoring Juneteenth celebrations, amongst other celebrations. We've been in a constant conversation with the Department of Public Health to create this Black Joy Initiative. to develop a health agenda for the Black community to improve health and wellness across the age spectrum. We've also met with our advisory board members for BHI to conduct needs assessment to understand specific needs of organizations and how and ways to meet those needs. We've implemented what we call Healthy Street pop-up clinics, which again, it meets the needs of the community. We've been working closely with Booker T. Washington, and I certainly want to put a plug out there for everyone who wants to engage with BHI and volunteer at these pop-up clinics to do so. We brought a diverse group of providers and volunteers together to meet the needs. And so we have a long laundry list of volunteers that are Black physicians, Black staff, Black medical students. We have formed a the first Black-led student-led clinic by our medical student, Jada Williams, who was awarded a partnership grant from UCSF and also recently awarded the Chancellor's Award for Public Service. She has also created a student board. And so those individuals on that board are helping BHI to sort of engage with social media, engage with our community partners. We've also created a research team that consists of researchers to help define short-term and vision and a roadmap to create a 6-month sort of strategy on how we can meet the needs of the community through our research work. We're also about to create a dashboard of sorts, a database of Black faculty researchers for external and internal review. And also we are engaging via our social media. So if you check us out on BHI social media on Instagram, any of the platforms, we've been creating some sort of content so that we can help to inform the communities that we serve. So again, I've talked about, some of the work that I've done on commissions or the committees and how important it is to not only do the research, but making sure that we, go to the end of the spectrum and implementing that the research through policy. And also the work that we do with BHI, which is very important in terms of meeting the needs of the community through our engagement with community-based organizations and ensuring that, there is this non-transactional relationship with our community members in order for us to be a good team player and a partner with the communities that we serve. And another plug out there is if you have any questions about how to engage with BHI, how to get engaged with even the work of the Homelessness Commission, you may feel free to connect with me at any time. So thank you.
Thank you so much, Dr. Butler. And, collectively, we felt it was really important to not only tell the story of what we did together around soda tax and water equity, but to make sure folks are aware of what opportunities exist right now, today, in community, and in particular in those communities, once again, disproportionately burdened by health inequity. So next, we're going to hear from one of our community partners, and that is Joy Jackson Morgan, who is the executive director of Third Street Youth Center and Clinic. Third Street Youth Center and Clinic began in the Bayview Hunters Point to address the needs of folks, of young folks there. And we're going to hear more about the work of Third Street Youth Center and Clinic and Joy's work as well in partnering with us to advance water equity and the implementation of the soda tax. Welcome, Joy. Please introduce yourself.
Thank you, Roberto. Like Roberto said, I'm the executive director here at Third Street Youth Center and Clinic. And a little quick story about how I got here. My background is actually in research. I am a graduate of Charles Drew University of Medicine and Science, and I was doing a lot of work on liquid calories down there with pre-diabetics and diabetics, particularly around like young people, but also some of our adults. And so I got involved with applying to be a part of the committee because of our young people. And I'd be remiss if I didn't give them a huge shout out. The campaign came to Third Street in 2014 and met with our young people. They talked to our our youth outreach squad, which really focuses on health promotion, and they spoke to our Third Street Leadership Academy. And I don't know what happened, but the campaign didn't bring their A game that day. They didn't do the whole sugar, like showing them the Coke bottle filled with sugar. They didn't show them all that. They just weren't convincing to our young people. And so they voted collectively to not support the campaign in 2014. And the campaign tried to work with them again, and the student said no. We already told you. And in their own youthful way, they told them it was a regressive tax, and they had a lot of distrust of the government actually using these funds the way the campaign was saying that they were going to use them. So then fast forward to 2016, and the campaign came back and said, would you all support, would you get involved with door knocking and all these good things and advocating for it? And so at that point, the campaign came correct, and our young people voted to support. And so part of my dedication to them and making sure that they had some trust in democracy was applying to be a part of the committee to make sure that these funds were going to go back to the programs that these young people cared about and to their schools and to water access to our community. So I applied and was selected to be a representative for the Black African American Health Equity seat. I was co-chair for 3 years with both Roberto and Dr. Butler. And so my time on the committee and as chair, I was really proud of our work because from the outset, we focused on goals. We wanted to make sure that at least half of the money went back to community. And I think we did a very diplomatic, we had a very diplomatic approach to the work in terms of water access. We alternated each year on our recommendations or our advocacy around the spaces that we wanted to provide water access. So we would oscillate between either at the school district and identifying where those needs were and also in community. So we also at Third Street Youth Center and Clinic, we have a water station right across the street from us at Bayview Park. And, from time to time, we're monitoring. We're having our young people look at the condition of the water station, making sure that the city is maintaining it, right? No one wants to drink from a dirty water fountain, especially when we're trying to encourage the public to utilize these water stations and that the tap water is safe. So we're often monitoring at least our station that's right next to us or right across the street from us. And I think Dr. Patel talked about just even having organizational policy shifts makes a difference. And so once we decided and the young people voted to be a part of the campaign, we made a policy shift. We don't allow sugary beverages to be purchased at Third Street. In fact, every once in a while, someone will make a slip up ordering pizza or something, and it'll come with a soda, and the youth are shocked, the staff are shocked, and they're like, "What? This is a treat. We never have soda." So just getting that mindset, I feel very proud that we have like the newest generation of LaCroix drinkers, right? Like we've gotten them off soda and at least into some kind of carbonated alternative water, and then into just plain water. So, it's a feat with young people right now, like they are being selective with what they want to drink. In addition to our water advocacy, we've worked on the healthy retail projects too. I think, again, Dr. Patel alluded to that, or Roberto alluded to that. We worked on like having healthier choices in our neighborhood corner stores and liquor stores so that we can be a part of that change. We also work heavily in food insecurity work. And so as a co-chair during the pandemic, I'm really proud of our work that we advocated to have some of the funds from the tax be concentrated into food. And so like our young people have also taken that on and have done several food security projects. And I think some of the next steps that we want to see at Third Street is this adoption of water stations at a community level, right? There's several here in Bayview Hunters Point that are located or co-located in places next to nonprofits, to schools, and it would just be great if we just created a adopt your water station campaign here in the neighborhood. And I think we also need to continue some education around water station safety and tap education. One of the things we've learned is that when you're playing at a park or it's warm, you don't think about like going to take a sip of that water, but we still have people hesitating to drink from the tap. So I think there still needs to be a lot of education around that, and I'd love to talk to young people to see how Third Street can lead the way in this education. So ways to get involved. We run San Francisco's first and only transitional age youth navigation center. So working with the unhoused population from 18 to 27. So if you ever have some clothes that you want to donate or you want to donate your time, that is one way to get involved. We also have a water station, several water stations at the navigation center too. So if you ever want to donate some of your water bottles, we're always looking for that. And lastly, if anyone wants to come be a mentor for our allied health program, some of our young people who want to be in research or in health careers we're always looking for mentors. And if you want to come and present some of your research to our young people or recruit them, we're always welcome. So thank you for this time. And I miss some of these great people who have continued this work forward. Thank you.
Thank you so much, Joy, and thank you for sharing opportunities with our department and all the viewers for how they can support the work of Third Street Youth Center and Clinic and the young people of Bayview Hunters Point. I hope all of you will take up Joy on that welcome and that invitation. Next up, we will hear from our partner, Marianne Zito, from the Department of Public Health, a key leader in this work leading up to the passage of the soda tax, and still a key leader in the implementation of the soda tax at the Department of Public Health. So, Marianne, please introduce yourself.
Thank you, Roberto. Let me share my screen. All right. Good afternoon. My name is Marianne Zito, and I am the Acting Chronic Disease Prevention Manager in the Community Health Equity and Promotion Branch at the Department of Public Health. I am really humbled to be on this panel with such amazing people. My role has always been behind the scenes, serving as backbone for the for the Shape Up San Francisco Coalition, and the first advisory committee of the soda tax. And so I've really helped lay the groundwork for the soda tax, working with community partners and health equity coalitions to understand how sugary drinks are linked to chronic diseases and how the industry is targeting youth and people of color to drink their products to increase profits. Now, you've heard from Dr. Butler and Joy about the importance of ensuring that the soda tax funding is going back to the community that the sugary drinks industry is targeting. So I'm going to use my time to shine a light on the amazing work of the soda tax funded community-based grants program. Before I do, I'd like to remind us of how we got here and provide some context for what I think Abby will touch on in her talk. Like Joy mentioned, the 2014 was the first time that San Franciscans voted on the soda tax. Prop E was a dedicated tax that would earmark the revenue for nutrition, physical activity, and health programs. And while the majority of San Franciscans voted in favor of the tax, it fell short of the 2/3 supermajority that was needed to approve a dedicated tax. But in 2016, following the footsteps of what passed in Berkeley, San Franciscans once again voted on a soda tax, but this time as a general tax. And voters approved the creation of the advisory committee to evaluate the tax and make funding recommendations. So you've heard from Dr. Butler and Joy, who along with Roberto were on the inaugural advisory committee. And since 2018, the soda tax has generated nearly $70 million for priority populations and places that are most targeted by the sugary drinks industry. But because this is a general tax, about 20% is set aside for voter-approved mandates. So this number does not include about $20 million for the total amount that's been generated. Now, this is a breakdown of the advisory committee's recommendations for 2 fiscal years, but since their inception, the committee has consistently prioritized the majority of funding to be directed to community-based grants. So 1/3 of the committee's recommendation goes explicitly to a community-based grants program that's run out of the Department of Public Health's Community Health Equity and Promotion branch. You'll see that in orange. These multi-year competitive community-based grants fund programs, services, and policy systems and environmental strategies. But it's worth noting that other slices of this pie also fund community-based grants. So the oral health is nearly 10% of the committee's recommendations. You'll see that in pink, and that includes funding for community task forces. In green, that represents food access recommendations, and a portion of that goes to the Heart of the City Farmers Market. And then in blue is the recommendations for the San Francisco Unified School District, and a portion of that funding goes to 3 community-based organizations to provide physical activity and nutrition education programming. Uplifting opportunities for community-led, culturally responsive programs and services, and to support the leadership and economic opportunities for the community are a core value of the work that is funded by the soda tax. So my team is currently working on the evaluation report for our fiscal years 23-24, and the following is a sneak preview of some of those findings. So from the map on the left, you'll see that the distribution of funded programs and services are serving the neighborhoods where our priority populations predominantly reside. And as you can see from the chart on the right, the number of unduplicated participants in SDDT funded programs continues to increase over time. So this is a snapshot of the impact for this fiscal year. So the green represents our reach. As I mentioned, nearly 90,000 people participated in SDDT funded programs, and over 81,000 of them were San Francisco residents. So the pink shows how SDDT funds created economic opportunities in our priority populations and the diversity of the people paid with SDDT funds. The highlights in orange and blue show changes in our behaviors and beliefs. So you've heard Anisha talk about water equity efforts. I'll just note that 85% of participants now drink water more often. In terms of food security, 85% of food insecure participants worry less about having enough food after participating in an SDDT funded program. And 92% of food insecure participants have increased their fruit and vegetable consumption. It's also worth noting that in the second cohort of our Healthy Communities grants, we have the first ever SDDT funding that's dedicated specifically to reach the Native American and Pacific Islander communities. We know that public health interventions take time, and that's why it was so important to design these funding opportunities for our community partners as multi-year grants to create organizational stability, to invest in the capacity of our community organizations and their staff, and to allow them to increase their ability to serve the communities in the ways that they know best. So the examples you see here will have a sustained impact for years to come, and they're just a few of the highlights. We know that Promotora have long played a critical role in community health promotion, while Crescent is wrapping up their 5th and final year of their policy systems and environmental change grant. And that grant allowed their team of Promotora to not only continue the important work on education, outreach, and linkages, but they were also trained to lead PSC changes that have resulted in a pilot program with SFPUC to increase confidence in tap water for San Francisco's Latinx community, as well as systems changes to improve outreach to monolingual Spanish speakers with SFPUC. SOMCAN was in our first cohort of Healthy Communities grantees, and their community health ambassadors that advocated for and secured a permanent slow street in their community. And lastly, over 21,000 San Francisco Unified School Districts students attend schools that are serving meals in refresh kitchens that are made with fresh and mostly local ingredients. So these are just a few highlights, and next month we will have a full evaluation report available on our website, sf.gov/SDD-TAC, that you see on the screen. The soda tax has supported incredible work in and by our communities. However, if you have been following the city's budget, you will know that all of this progress and this amazing work that is designed and led by these community-based organizations is at risk because of how the soda tax was designed as a general tax. Now, since 2018, the mayor has, for the most part, adopted the recommendations of the advisory committee. But this past year, the mayor's cuts to the soda tax budget had a devastating impact on our funded CBOs who rely on these multi-year grants to provide organizational stability so that they can focus on building the capacity of BIPOC community members and improving the health of the communities they serve. I'm going to pass it to Abby to talk about the current state and threats to this funding and how it impacts the communities that this funding is meant to bolster, the very communities that are the most targeted by the sugary drinks industry and who bear the greatest burden of preventable chronic disease. Thank you.
Oh, I'll take it away. Thank you so much, Marianne, and good afternoon to everybody. I am Abby Cabrera. I'm the Associate Director of Research, Research and Community Engagement at the Center for Excellence in Primary Care at UCSF, and am the co-chair of our Sugary Drinks Distributor Tax Advisory Committee. I have been serving in the research medical seat 4 of the last 7 years, and I'm excited to share with you today what our committee has prioritized, where we are, and some of the opportunities that it can present with leading to a call to action. So as Marianne stated, and a reminder to us all, the soda tax is not a sales tax. So the distributors are the ones responsible for paying the tax, and thus the name Sugary Drinks Distributor Tax. As previously mentioned, also, it's a legislation tax that goes into the general fund and not into its own bucket. And so the remaining amount, which you can see on the table, has been designated to the committee. And each year we make recommendations on how the money goes back into the San Francisco community. And since it is not a dedicated tax, the committee can only make recommendations. So the mayor does have the final say and the final allocation. There are 16 of us that sit in this committee, and collectively we spend over 500 hours annually in various meetings of subcommittees and within the full committee. Our 2 charges from the legislation is to evaluate the impact of our soda tax. And secondly, like I mentioned, is to make the recommendations and speaking to the programs that can reduce the consumption of sugary drinks in San Francisco. Our priorities are followed. We are rooted in the principles that all my colleagues have previously spoken to. So we do remain committed to investing in the communities most in need of chronic disease prevention. We prioritize recommending funding to the program's activities and policy implementation to improve healthy behaviors and attitudes related to drinking more water, drinking fewer sugary drinks, and increasing fruit, vegetable consumption, and increasing physical activity. We prioritize focusing on improving food security by providing community-led programs and services, as well as supporting structural and systemic changes that increase access to healthy food. There are a handful of the soda tax funded community-based organizations that continue to provide direct services in increasing food access to the communities most in need. And here we continue to support strengthening leadership and connections in the communities most impacted by health inequities that also can lead to long-term benefits, some of which you already saw presented by Marianne. Now, the more important part of my presentation, the current state of the sugary drinks distributor tax, also known as the soda tax. In the most recent budget that we submitted to the mayor and received allocations for was fiscal year 24. So the Soda Tax Committee, we are given the $10.9 million budget. And what you see on the table are the recommendations we made to the mayor with the following funding categories. Marianne spoke to the community-based grants. We always recommend water access, as also highlighted by Dr. Patel, and also in this multifaceted approach around food access, supporting our students, physical activity, and of course, in infrastructure. We continue to prioritize our community-based organizations and these activities. So in fiscal year 24, San Francisco faced the biggest budget deficit in the city's history, and therefore all of the extreme budget cuts. So as you see here, these were the recommendations that we submitted to Mayor Breed. And many of the programs and task forces that you see on this table solely exist because of the revenue of the sugary drinks distributor tax. And now that you can see all of the columns, on the third one has Mayor Breed's allocations for fiscal year 24. So like Marianne mentioned, since the inception of the soda tax and the committee, Mayor Breed has, for the most part, made allocations closely aligned to the recommendations. They have never been allocated exactly as voted by our committee. However, in this past fiscal year, we're in a very critical moment. This fourth column highlights the difference between the recommendations of our committee in comparison to Mayor Breed's allocations. And as we anticipated, cuts due to the severe budget cuts in San Francisco, we did not expect half of the sugary drinks distributor tax, and you can see that is $5 million here under the HSA programs. We did not expect half of this to be allocated to the San Francisco Human Services Agency. We do recognize the alignment of this agency's mission to support communities with food and more, but as you'll hear in a moment, that work was already being done by the funded sugary drinks distributor tax community-based grants recipients, and it was being done by local community-based organizations. And so our committee, the Sugary Drinks Distributor Tax Advisory Committee, SDD-TAC, we remain committed to the will of the voters in making consistent recommendations to the mayor and the board of supervisors that the revenue from the tax go back into the communities most affected. We continue to support funding programs and activities that provide direct services delivered by these community-based organizations and task forces, such as the 3 oral health task forces out of Chinatown, the Mission, and the Bayview neighborhoods. So following the fiscal year 24 cuts shared by Mayor Breed in June 2024, the committee and our communities, we strongly advocated to the mayor and to the board of supervisors to add back the vital revenue to the funding categories that were cut, especially for the community-based organizations and the oral health task forces. And in July of 2024, the Board of Supervisors voted to add back $2.7 million. So we were thrilled, really excited. We had put a lot of time and effort in writing letters, giving public comment, and really showing up in City Hall to advocate for these add backs. This add back was very crucial in ensuring the continuation of the direct services provided by our soda tax funded organizations as they are rooted in the communities they serve. However, to this day, only $250,000 of this add back was released by Mayor Breed, and the remaining remains unreleased. We have been strongly encouraging and advocating prior to January 8th for Mayor Breed to unrelease this funds to no success. So this has unfortunately had direct negative effects on SDDT-funded community-based organizations that were promised a multi-year grant and are now in their own deficit and struggle to continue in their organization and serving the community. So we are currently in the process of making and voting on the fiscal year 25 recommendations because of the process that Marianne shared due to the soda tax revenue minus the 20% we were given the amount of 11.625 million of how we want to make recommendations now to Mayor Lurie. So what I want to also share is that I invite you to join our January and February meetings as we will be finalizing our recommendations to Mayor Lurie. And so as I shared the table with all the numbers, all the deficits, all the cuts and the effects, what goes back to what's being very important is the community that it serves and our community leaders. And I want to share some of the quotes that were shared in public comment in our meeting or shared in public letters. How did the mayor's office figure that out and those of us who worked on this and working hard and take 5.2 million from the work we were already doing to support our communities? This is frustrating and confusing when the mayor's office did not think of us who are already and still doing this work. 700 turkeys are being provided, having a community garden and distributing food bags, so I don't know why, and I'm confused. This was public comment from our November meeting by a community member and grant recipient Uzuri Green. It is a gross misuse of soda tax funding to backfill a city department when organizations who were already funded and already had boots on the ground working with these communities. It lacks foresight to defund education to the community that needs it so much. And this was provided by Gabriela Castellanos from Carecen in public comment from our November meeting. Every day, families in our communities are struggling to make healthy choices while facing food insecurity and limited access to healthcare. These funds were promised to our communities to address these critical needs. The delay in allocating these resources is a betrayal to every San Franciscan who is counting on these programs to improve their health and quality of life. From Angelica Cabande, who is the executive director of SOMCAN out of the Tenderloin. This was provided to the People's Budget Coalition in an official letter that went to the Mayor Breed. It's simple. Unlock the funds and fulfill the promise made to our communities. The health of our children, families, and future depends on it. Quote made by Christine Mauya, the executive director of All My Usos, who was also funded and is waiting for the ad back. And another quote by Vanessa Baum, who is from Carecen, a former SDD TAC member, made in public comment in our June meeting. It is unfair to communities to have to come to provide public comment at hearings. It's outrageous that outreach and education is not considered pivotal to prevention work to deal with and to try to create health equity in our communities. The soda tax dollars were meant to go to address health inequities in the communities more affected by the consumption of sugary drinks. These community-based organizations are doing culturally relevant and effective work that reaches communities. We understand that food is important, but it is not everything that has to do with health. The first SDD TAC cohort fought so hard to get the soda tax funds to go to community-based grants, and now it is a slap in the face of the SDD TAC to have that money be redirected. Communities are suffering, and how is it that the budget is always balanced on the backs of communities?
Thank you so much, Abby.
I just have a few more slides and wanted to let that kind of just settle in, but wanted to present, if I can quickly go in that we do have this opportunity. We have a new administration and a new mayor to really advocate that he allocates per the recommendations of our committee. Also that we cannot wait until budget season of every year to show the impact of our work and to advocate. And we must continue to, of course, share with this new administration how it is vital to support the work of our San Francisco community-based organizations, which include task forces. And we know, and this is preaching to the choir, but true collaboration with our community, plus an effective tax, with the 16-seat multifaceted community can result in community change. And so how you can support is we are exploring an opportunity for a special dedicated soda tax. And so that the money is not threatened every year and the mayor does not have the final say, but the final say can come from a collective voice. We also would love the support to advocate to extend the Sugary Drinks Distributor Tax Advisory Committee beyond 2028. In the current legislation, it is due to sunset in 2028. We want to make sure that we can preserve the community and data-driven process of the informed recommendations in evaluation. In 2028, it will sunset unless the Board of Supervisors by ordinance extends the term of the advisory committee. And as leaders in research, UCSF is constantly publishing relevant data and evidence to support the efforts of chronic disease prevention. I encourage you to share it with the committee, stay up to date with our meetings, and advocate with us. One example is providing public comment. Mayor Lurie shared in his inaugural speech, you can't build strong solutions without good data. And we need to continue to provide that good data and also make recommendations to our solutions. And lastly, the other way to do this is to continue or to start investing in long-term benefits to communities. We prioritize these priority populations. We must all continue to invest in the long-term benefits. And the data and evidence exists on how to do this. So we must all continue to partner with, listen to, and financially support our community and faith-based organizations. So I hope my presentation was enlightening to the threats and challenges to the sugary drinks distributor tax and our advisory committee, but also bring forward the hope and the opportunity to continue the great work and impact this legislation has made in our communities. So this is my call to action to stay informed, to get involved, and support community-based organizations and task forces. We need a dedicated soda tax, and we need an extension of the STD tax beyond 2028. Thank you.
Thank you so much, Abby, and thanks to all the presenters. I don't see questions in the chat. So what I'll do as we close is just to make sure that you all are aware that you can reach out to the Community Engagement Program of CTSI for assistance. You can reach out to the Center for Community Engagement for assistance. If you're seeking to partner with community, seeking to partner with the Department of Public Health and other local city agencies and department, please do seek us out as a resource. Consultations are free, at least for the first hour, and you can request a consultation and take a look at our CE toolkit at this website with this QR code. Thank you so much.
I want to thank you to everyone who joined us today. This has been a really wonderful presentation. And just like Abby's slide said, this is only the beginning. So I look forward to hearing about further work and for all of us being involved. Thank you so much for everything you've shared with us for today and the work you're doing. Everyone have a good afternoon. Bye-bye.